My name is Dr. Dmitry Klokol, but everyone is calling me Dr. D. I'm a medical doctor, MD, and a PhD in regenerative surgery and regenerative medicine. Currently, I'm medical director for the international group and head of medical advisory board for the research division and also for the clinical division in our company. And my main focus now is preventive medicine, anti-aging medicine, regenerative medicine. And we mostly treat now people with a lot of systemic age-related disorders. We also do treat kids sometimes with various congenital diseases and diseases which are otherwise considered to be untreatable. We have the flagship is our main hospital in Germany, which is known as VILLA MEDICA, and it's a hospital with about 55-56 years of history of cell therapy. Also, our entire group, European Wellness, has another center. It's a boutique clinic in Lugano, in Switzerland, in south of Switzerland. Also, we have satellite clinics all over Southeast Asia. The main is here in Bangkok, European Wellness Center in Bangkok. And we also have a show center, a case center in Malaysia, where we train doctors and we teach doctors regenerative medicine. And we're also setting up clinics in Philippines, and we have franchised in other countries like Bangladesh and China, and also we're growing. Well, I'm 100% product of conventional medicine, so I get a proper training in Europe in medicine, and after that I've done my specialty in surgery and minimally invasive surgery. Then I did my PhD, and that was a long time ago. Well, my total career is about 20 years. And out of those 20 years, 16 years I spent in surgery and reconstructive surgery. And I worked in different countries, I worked in different continents. I worked in Europe, then I moved in Asia in about 11 years ago. And I was working in Asian countries. And then 4 years ago I've changed my career, I left surgery. I don't work for governments anymore. The main difference of us and everyone else is that the philosophy of medicine that we advocate and promote is quite different. First of all, we believe that early detection of disease and early prevention of the disease is much better than deal with the consequences and treat the outcomes of any disease. It is definitely more effective, and it's cheaper in the long run, and patients don't have to spend huge amount of money on medical bills and medical insurances and deal with the consequences of disease when in a stage when nothing can be done. So it's better to early detect and prevent the disease. We deal a lot with biological medicine, and biologicals generally, if you compare the biological treatment to the pharmaceutical based treatment, is safer. So the amount of the side effects, adverse reactions that very often come because of the pharmaceuticals, we don't really see that much with the biological treatment. And then if you want to regenerate tissue, if you want to regenerate the function of the organ, it is nearly impossible to do that with a conventional approach because most of the pharmaceuticals, they have a short act in time, and you are dependent on medicines, probably the daily intake of the medicines, which you have to take lifelong. And when you deal with regenerative medicine, with the stem cells and cell therapy, it's a totally different ball game. Most of the time patients do not have to get any injections or supplements or medicines lifelong. It is a specific protocol which we design, and it's individually catered for every person. It is individualized, it is a personalized medicine. So every patient gets their own individualized and personalized treatment protocol. And usually this protocol will take only a specific amount of time. It can be a one-shot injection, or can be a few weeks of few injections within a few weeks, or maybe 1 or 2 months. And after that, patient is generally well for about a year, sometimes up to 2 years. So they can enjoy the results of the treatment and feel good, have a good quality of life, and have a generally great state of well-being. And the treatments that we are providing patients, they are absolutely safe and extremely effective, and patients usually are not hooked on the regular medications for a long time. So definitely it's easier for patients to accept that as well. First of all, my vision and my philosophy is such that whatever I do to my patients and whatever treatments I advocate and promote and advise patients to do or prescribe or do for patients, it is always that I experience myself first. I have tried all therapies that we do for our patients on myself, and some of them, quite a lot of them, I do regularly because I do travel a lot and I have to work in different countries very often. So I also have a burnout syndrome, I also get tired, I have to take care of my health. So whatever I promote, I try on myself first. And not only on myself, on my family members, on my loved ones, on my close friends. I can be an example of the safety and the efficacy of these therapies. I've been able to effectively treat my own metabolic syndrome and my own problems with the high blood pressure and all. I'm not on any medications anymore. I just maintain my health with supplements and with cell therapy that I do occasionally. That is first. Secondly, I do believe that in medicine, safety first. Before I prescribe any treatment to our patients, I will study what are the possible adverse reactions and side effects. So if we suspect that the risk of the disease may exceed the benefits of the treatment, we would rather not do it and look for a safer solution. Thirdly, I believe that a correct diagnosis and very, very in-depth and specific diagnostic procedures have to be done to every patient, because it is very important to diagnose the illness at a very, very early stage. Preferably before you have full-blown clinical manifestations, and you can just pick it up maybe from some specific blood investigations. And when you will do a treatment or preventive procedure timely before that, you can effectively reverse the disease or even prevent that from happening. One more thing that we never forget in our practice, and especially for me as a scholar, I do believe in principles of evidence-based medicine. And that principle is introduced by the modern conventional medicine. And it means that whatever treatment is offered to the patient, it has to go through a proper clinical and research assessment with necessary clinical trials. Although it is very difficult to do it in regenerative medicine, because all the treatment that we provide is an individualized and personalized treatment. It is almost impossible to have two different patients who will get absolutely the same treatment protocol. But still, in spite of all the odds, we're trying to do that. So we always analyze the results of our treatment. We analyze the statistics. We evaluate the positive outcomes, and we do pay a lot of attention at the outcomes which are not 100% satisfying, and we're trying to improve that every time. So a scientific approach, a proper scientific background and explanation to our treatment is very, very important, and it is a part of our daily practice, and it's our main philosophy as well. So evidence-based medicine and scientifically backgrounded and substantiated treatments, it's very important.